Hi, everyone. Welcome. Oh, it looks dark. Oh, no, that's better. Okay, good. Hello. Welcome, everyone. Hospice Nurse Julie here. Let me switch some things up. Let's see. How do I like how this looks? I'm not crazy about it. Hi, everyone. Welcome. Can everyone hear me okay? If I'm looking up like this, it's because I'm looking at the camera. When I'm looking down like this, I'm looking at the chat. I'm finally back. I was gone for 2 weeks because Richie and I, my boyfriend, went on a little road trip. Hi, Lori. Welcome. Welcome, Steph. Welcome, Sally, Tanya, Jennifer, Patty, Margaret, Tanya, Megan, Diane, Alexi. Welcome. Look at me like my high and tight bun. Hey, Stacy. Hey, Adrian. Welcome, everybody. Come on in. I'm still trying to figure out exactly how I want the background. None of this is exactly as I want it. Yeah, I'll figure it out one of these days, I promise. So again, if I'm looking at here, I'm looking at the camera. If I'm looking down, I'm looking at the chat. So for anyone who's new, if you're watching this right now, my name is Julie McFadden. I'm a RN BSN. I'm a hospice and palliative care nurse. I go by Hospice Nurse Julie online on YouTube. And I go live at 5 every Thursday, Pacific Standard Time. So I'll be on here for 1 hour and I will answer any of your death and dying questions, palliative care, hospice care. I'll answer almost anything as long as it's somewhat appropriate. And I can't give medical advice, of course. This is a community of wonderful people here. So please be kind to each other in the chat. Feel free to respond to each other. Again, as long as you're respectful, this is a community of people here. So if you're looking for community, you do have it here. And again, I'm live every Thursday at 5 p.m. Pacific Standard Time. Now, I have been off for the past 2 Thursdays because I was on a road trip, baby. Hey, Megan. Okay, so I'm going to say hi to everybody. Brody, thank you so much. So anyone saying thank you or any of this, any sort of the thing, I want to say thank you for being here. Heather, I'm back on hospice. They're not keeping me comfortable. I can't get, Heather, I'm so sorry. I don't know if you're allowed to switch hospices, but you can switch hospices. Try to be as vocal and as advocate-y. That's not a word, but advocate for yourself. Thank you, everybody. How are your book sales going, Michelle? They're going good. You know, if I'm honest, I don't ask. It made the New York Times best-selling list the first week. And after that, it made good sales as well. It's always in the upper levels on Amazon, but I've never specifically asked, and I don't plan to. I can't, it's not good for me to like focus on that. But overall, I think it's good. Can I have home hospice without a caregiver? Of course, Sherry, you can have home hospice without a caregiver. However, you will eventually need a caregiver, and hospice does not provide that. So you will eventually need family members or a friend or a paid caregiver to come care for you, because eventually anyone on hospice will be dependent on another person. Welcome, everybody. Hi, Janine. I think your name is Janine. I'm really bad at pronouncing names. Jane or Jan. My book is in Canada. So my book is called Nothing to Fear by Julie McFadden. That's me. It's a best-selling book. Thanks to you guys. And it is sold in Canada. It's sold worldwide. And it's actually being published in 3 or 4 different languages. We just haven't, it hasn't come through full circle yet. Carol, you're my inspiration as a CHHA hospice Care Roy! Baby, are you okay? Did you guys hear my dog? My baby. My dad passed away last week. He claimed to see scary ghosts and people, and he saw people walk through the walls. Is this common, Amy? Amy, it can be common. Do you mind me asking what his disease was? What did it happen to be? Parkinson's, Alzheimer's, dementia, anything like that? Thank you, everybody who's saying thank you and telling me their stories. Can we see your puppy? I myself have a sweet barky puppy. You can see, can we see Roy? Yes, give me 1 second. Can you talk about late stage COPD? Heather, I can. Oh, maybe your dad had late stage COPD. Let's see if it's the same. Oh, no, it's not. Oh, good. I pronounced it correctly. Yes, Megan. Thank you. Megan said tap the heart, which I think helps the live. Oh, the heart is in the lower right-hand corner. I couldn't see it myself either. Heart disease, possibly Alzheimer's. So, Amy, the reason why I say that is a lot of times if any of my patients have ever seen anything scary or bad, they usually had Parkinson's or some form of dementia, which Alzheimer's is a form of dementia. So there's something, well, one, Parkinson's, there a disease, the part of a symptom of Parkinson's is seeing things, and they're usually like ghosts, or not ghosts, I'm sorry, spiders, or like ghostly looking things that appear scary, like tree people, some people say. So they actually will visually see things. That's a symptom of Parkinson's disease. And also people with dementia and Alzheimer's, for some reason, I have seen the most of like them seeing scary things. I think it's just because cognitively there's things going on with their brain. Michelle says, Julie, my husband knows he's dying but doesn't want to and is fighting the process. How do I help him come to acceptance, or does he have to come to it on his own? So Michelle, I'm not sure if he's already on hospice. If he is, I would talk to his hospice team and see if the social worker, the chaplain, if you can't have like family meetings or even like weekly meetings just to talk about things, I think the more honest we allow him to be, right? So if he is like, I'm going to fight this, I'm not going to die, I don't want to, I'm angry, like all of those things are okay. Like I'd rather him be saying those things than like nothing at all. So even though he is saying things that don't seem like good or accepting, I feel like it's good that he's even being honest. So that's a start. So whenever I hear a patient talking like that, I always say, I'm so happy you're even willing to say any of this. People who are willing to talk about it, even if we think it's in a quote unquote negative way, usually do better, do better. But also, he will have to come to it on his own. I would say let him vent, let him talk about things, bring in a licensed social worker, which hospice has, unless he's not on hospice yet. Then you could even mention me. You could always bring me up. Uh, you could always try to open the door to conversation. Talk about how you're feeling at first. Talk about what you're scared of, what you're hoping for. Um, Things like that. Whatever you do, don't deny how he's feeling, right? Let him feel and act and be the way he wants to be. But you can say, you know, I have so much fear around what's going to happen to you because I feel like you're resisting this so much. And all I want to do is be there for you and be a support for you. How can I better do that for you? Like, what can I do to better do that? See what he says. But it's really hard. You're not doing anything wrong just because it's hard. Just because it feels hard or feels uncomfortable. It's just is sometimes. Okay, give me 1 second. I'm gonna go get Roy. Roy, come here, baby. What are you doing? Why are you a weirdo over here? Why are you a weirdo over here? Is everything okay with you? Is everything okay with you, Roy? There he is. There's the baby. Rochelle. Roy, the baby of the hour. Oh, he wants nothing to do with it. Thank you, Teresa. Okay, Roy, are you gonna say hello? Hello. Say hello to everybody. Okay. Nani K. I'm glad you're here. Welcome, everybody. How many pairs of scrubs do you have? I'd say about 12. This is what he does all the time, you guys. Roy. You're interrupting our live, baby boy. Okay, now I'm just reading through the comments. So if you already asked something and I haven't been reading it, just keep writing it and write it in all caps. I'm going to be on here for an hour, so I will get to many questions. Margaret K. Baby Roy, please stop, honey. I love you. Margaret K. I think palliative care is harder to get on than you think, but you can always ask your doctor about it and see if you can get on. You never know. Yes, my dad had advanced dementia, kept looking over my shoulder the night before his passing. Hold on 1 second. Roy, sweetie, what's going on with you, baby? He has been kind of acting weird all day, like a little on edge. Honey, are you okay? It's okay. Aw. Talk about end stage COPD. So I have several videos, well, probably 2 or 3, about end stage COPD on my channel, Hospice Nurse Julie. Just look for any video that says COPD. So know that that's there as well. But just generally speaking, COPD is a lung condition, lung disorder, lung disease that is a life limiting illness, and you can live with COPD for a very long time. So by the time we see COPD on hospice, it's very, very, very advanced. And the patients are usually on oxygen, on a nebulizer machine. So they take like albuterol and Atrovent usually. They're on high dose steroids. And they usually will be taking morphine, little bits of morphine, little bits of Ativan to help relax their diaphragm, relax their central nervous system, so they don't feel so short of breath. So we can manage your shortness of breath. That's no problem. You will start becoming debilitated though because of the disease. So just like anyone at the end of life, you will not be eating and drinking much. You will have a functional decline. You may have a mental decline and you'll be sleeping a lot. Now, that's for any disease, but COPD at the end of life with COPD, you will look like that. The main symptom, again, is shortness of breath, but we can manage that. So, your quality of life as time goes on does diminish because you can't do much because you're so short of breath. But as far as like feeling like you're going to suffocate, that we will not allow to happen. So you may have moments or periods where it's like, whoa, it's really hard to catch your breath. And it may feel like that for a few moments, but we'll always have something in the house for you to help relax you. So when you're dying, like that actively dying phase, you will not, I repeat, will not feel like you're suffocating. Amy K, no, I'm so sorry. I don't do personal one-on-one talks. I've decided against that. But I am live at 5 every Friday. And I do believe I'm going to be starting a call-in show where people call in and I try to answer their questions. So I may start doing that. My son has liver cirrhosis and continues to talk to himself. Is that the end of life symptom? He still drinks on a daily basis. Oof. I'm so sorry, Heather. That's so hard. Talking to yourself, I wouldn't say is an end of life symptom. I think with liver cirrhosis, your ammonia levels start rising up, which makes you confused and you start acting a little off, a little strange. And talking to yourself would be one of those things. Can a rally last longer than a few weeks? No. A rally can't last longer than a few days. Yeah. So, no, you wouldn't have a rally for weeks. A rally is something that would last for a few hours to maybe a couple days. A lot of times, people who are 96 years old, Lewy body dementia. So, dementia patients will go up and down, up and down, up and down kind of all the time. So, that could be what you're seeing. No problem, Amy. I'm so glad you're here. Let's see. Thank you, Tanya. Welcome, everybody. Come on in. If you're new, I'm hospice nurse Julie, in case you don't know. I've been trying to answer as many questions as possible. Lauren says, end of life, fever without medicine. Oh, I don't know. We do have people do get many fevers at the end of life. A lot of that is unknown. We don't know why. Some people think a lot of the reason is because we lose the ability to control our core temperature. So we have mechanisms that help us keep at a temperature of 98.6. When our body is dying, that starts fluctuating. So we may feel really cold, but be really hot, but feel really cold. We may spike fevers. A lot of times we just give Tylenol suppositories if we have to, or we just put really cold cloths on foreheads in any kind of pit area, like right here, under the knees and the armpits. That can be really soothing. Hi, Julie. When someone has a peaceful transition, are there other tall tale signs? Yeah. So tall tale signs of transitioning and getting close to death. I think I've talked about a lot, but I'll do it again. So people they'll be fully unconscious. Their eyes and mouth can be open. They don't have to be, but they can be. So their eyes are open, but they're not making eye contact because it's like no one's home, right? They have that blank stare. Tall tale sign of end of life is getting near is changes in breathing. They're not going to be breathing like you normally see them breathe. They're going to have changes in skin color. And then also changes in skin temperature. They may have a little gurgling or like a wet breath. They are not drowning on their fluids. They are not drowning on anything. It's like a little bit of secretion in the back of their mouth. It's called terminal secretions, and it's to be expected. It's basically like how I just automatically swallowed that saliva. At the end of life, your brain is still making saliva in your mouth because a moist mouth is comfortable, but your brain and these muscles are no longer in cahoots and like swallowing naturally. So it just sits there, and then your mouth's open, and then with every breath, it creates a little wet sound. If I may ask, as Jimmy Carter has been on hospice for an extended period, what do you think will be clear signs that Jimmy Carter will be near the end? Nicole, I think he already is near the end. We saw that video of his 100th birthday. I made a video about it. I think he's one of those very, very elderly people who just has really, really great care and probably a brilliant like will to live. I wouldn't say he's fighting, but just like his body for some reason is not letting go. Clear signs we as the public will not be able to see. Clear signs the family will be able to see. They probably are already seeing. He probably already is sleeping 22 hours a day. He probably already is barely eating and drinking. But signs will be not drinking at all. The second Jimmy Carter stops fully eating and drinking, which will come a day when that does happen. I feel like that's when we're going to know. He's sleeping 24 hours a day, not eating and drinking. And that's when we know this is the end. He will be gone in the next, few days. That's what I think. But who knows when that will happen? Hi, Julie. From your experience, once stage 4 colon cancer starts to spread to liver and stomach, how long is a person's life expectancy? Stan, I am not just saying this to like sugarcoat anything. I swear to you, if I knew, I would tell you. just with that information there, it's really hard to know. It really is. There are so many things that can come into play. If surgeries can be done, if there are still more chemos, what there's just so many other factors that can come into play. It's really hard to know. Now, generally speaking, when a cancer is moved to several parts of the body, you're it could start becoming an incurable cancer. So that means, like, technically it would be like terminal, but that doesn't necessarily mean you're terminal and like you're going to die in 6 months. That could mean that you'll likely die from this disease, but maybe in a few years, which is still not long, right? But like that could be the case. So there are too many factors in that scenario for me to give you a good answer. And I think it would be unethical for me to go, well, I think waka waka waka, when I would need to know so much more. So generally speaking, it's not like the best news to have cancer move to other organs, but it's also that doesn't always mean any kind of clear answer. There could be several options. My suggestion to you, if this is because of you or someone you know, my suggestion would always be to be super transparent with your oncologist, your surgeon, your radiologist, anyone that you're dealing with. You need to be very, very clear about being open to end of life conversations. And if they seem uncomfortable with end of life conversations, you need to talk to them about that, because I'm not saying it's end of life, but I think doctors need to know, the more you can tell doctors and other people that work in healthcare that you're comfortable with having these conversations, the easier it'll be for them to bring it up. So I would ask them, what is the progression of this disease? What do you typically see with patients with this disease? How do most patients react to this chemo? Does it extend their life? Could it possibly shorten my life? There are so many things to ask and talk about. And not to plug my book, but I can't help it because my book my book does give like step to step things like to ask doctors if you're going through something like this, because you don't know what you don't know. Anyway, though, Stan, I'm glad you're here. I'm glad you're here. Jill, I don't see many pulmonary fibrosis cases. I used to work in the medical ICU where I saw them a lot. Every once in a while, I'll see them on hospice, um, but not often. And I don't know why. I think maybe because a lot of times they're younger patients, and it's like this chronic long-term illness. I think a lot of people die in the hospital with pulmonary fibrosis. Hey, Sharon. Sharon, welcome to the Compassionate Companions. I do have a membership program. I think it's like $4.99, and you get all these little. You get I see your name easier, so in the chat I'm able to answer your questions easier. You get to join a community. Once I get this community, a few more people in the community, I'd like to do more private events, but it's just going to take some time. So meanwhile, I think it just offers you a tighter community and the ability for me to answer your questions. Oh, Shannon, I'm so glad you're here. Anyone who's been diagnosed with any kind of life limiting illness or any kind of illness that just feels scary, it's so amazing that you're willing to be here and to talk about it. Oh, Stan. Okay. Thanks, Julie. He's 85 and on hospice. Okay, Stan, if you're still here, if you are still here, he's already on hospice. Great. So let his body be the guide. Let his body be the guide. It's too hard to know how quick or how not quick things will happen. Um, I would just say let his body be the guide. Ask yourself, is he clean? Is he safe? Is he comfortable? If all of those things are yes, there's nothing you have to do. Don't force anything. You can offer all the food and water you want. If he wants it, great. If he doesn't, that's okay too. And just and hospice will help manage his symptoms. Hospice will help manage his symptoms. So just let his body be the guide. I was at the bedside of a friend of mine who was breathing like a whistle. Her mouth was very open and sunken Looking. What causes mouth to sink in? It's very scary looking. Yeah. Yeah. She had all of her teeth. Yeah. So, what causes the mouth to sink in? So, it doesn't necessarily always happen where someone has like a sunken in mouth. Give me one second. Roy, my lovely darling, stop it, baby. He does it all the time when he's like trying to get comfortable on the couch. He'll like sit there and scrape at it. Like he's burrowing. So here's what I'll say about like why do certain things happen that kind of make someone at the end of life look scary, right? The main reason why is because all of the muscles on that body are relaxing. They're relaxing so much that they start doing one of these. There's muscle wasting, they're thin, their body is fully shutting down. So it's hard because we're thinking of this person and their personality. And really, I feel like at the end of life, the person that you know, their personality, I feel like that's kind of going away, right? And now we are just with this body that is shutting down. And the body is a biological system, right? Working together. And it's actually working together beautifully to try to help it shut down. But we're not used to seeing that. So when we do, it can be really jarring. The person usually loses weight. They're not eating, drinking. They're not eating and drinking. They're dehydrated, which they should be. The drier you are, the better you will die. That's a whole nother thing I can get into. I have videos about that. So it causes everything to look a little sunken. They can look cachectic because they haven't been eating. So it's very, very normal, and there's nothing actually wrong. We're just not used to seeing it. Hence why I show videos of what it looks like when someone's actively dying, so people can see how shocking this can kind of look. It looks so shocking because we're so not used to seeing it, but it's the most natural thing that could possibly happen, just like birth. Most natural thing. So, you're not strange for being like, "Yikes, this looks scary." But it's mostly just our body shutting down, and we're not used to seeing bodies shutting down. And a lot of it has to do with muscle wasting and muscles relaxing, fully falling. Okay. Sherry says, I hope everyone's still here. People who are asking these questions, and I'm getting to them now. Your end stage liver disease video was very helpful. Do you see more hemorrhaging out versus complications, NASH with decompensation, cirrhosis, ascites, portal hypertension? I actually don't see many hemorrhaging out. I don't see that a lot. So what she's talking about is people can get esophageal varices when you have liver cirrhosis, and then those varices burst, and then you can bleed out, or you don't have to bleed out from esophageal varices. You can bleed out from like any little thing because your blood's no longer coagulating. I don't really see that much, though. I have seen it, but not much. People who die on hospice with liver disease, no matter what type, do can have a lot of symptoms we have to manage, but we are able to manage them at home on hospice. And people who die this way in hospice specifically, I feel like we do a good job at keeping them dry, keeping them comfortable, and not doing too much, right? Only giving medications that are needed to help manage symptoms and nothing else. I feel like it's in the hospital where we overhydrate liver patients. We do too much, and I feel like that can cause issues. On hospice, you don't see it that much. Yeah, Jules, I see that too. Kiwi, I'm glad you're here. Welcome, everybody. As a funeral director, one of the worst things is the dropped mouth. Yeah. Agitation from a 76-year-old Parkinson's patients with UTI and hospice. Yep. Hospice nurse is now recommending low dose of morphine. Why not Ativan, Valium, or CBD oil? I feel like morphine will knock her out. Nancy, that has not been my experience. So Ativan Valium would definitely knock someone out more than morphine. So morphine, especially with a little amount we give people. Now I can't speak for your case because I have no idea. So I'm not giving you specific medical advice, but just generally speaking, I always um I always educate that Ativan will knock someone out more than morphine will. Um, Especially the ones we give on hospice because it's usually 1 milligram. Most people are used to 0.25 or zero point 0.5. Unless this person's really used to taking Ativan, then maybe that wouldn't knock them out. But the amount of morphine we give people usually does not knock them out. It usually just helps them relax. So, but you could always try that stuff. I mean, you could always try it. So I'm not against giving Valium, Ativan, or CBD oil, but I'm also not against giving morphine. So it's like educating to like not be so afraid to give morphine. Morphine will not drive their respirations too low. It's not like we're giving like a boatload, and we're usually giving it sublingually under the mouth or in pill form. So should be okay, generally speaking. But I wouldn't be opposed to the other stuff either. So it's up to you and your hospice workers. But just don't be afraid. Morphine gets a really bad rap, and we give such minuscule amounts of morphine. Really, we're just relaxing their central nervous system, relaxing their diaphragm to kind of like relax them. Someone just wrote, "Thanks, still scared." I know. It's okay to be scared. It's normal. It's normal. When did hospice become a thing people went on in America? I think it started in the 70s or early 80s. Love my hair up. Thanks, Deborah. Only shocking thing for me was the icy cold random spots on her body. Still don't understand them. That is weird that it's icy cold random spots. Usually it's like the whole body is, or the feet, the hands, the nose. That would make sense. Normal for the death. Yes, it's very normal to have fevers at the end of life. Very normal. What is terminal restlessness? And do you advise giving them comfort kit to avoid it? I would not advise giving it comfort medications if they're not having terminal agitation, like just in case. I would advise you calling your hospice company if you start seeing terminal restlessness and then start giving medications 100%. But I don't think you need to give medications just in case. And what does terminal restlessness look like? Terminal restlessness looks like anyone who continuously tries to get out of bed, like over and over and over again, and they don't seem to really be home, right? You can't like talk them into staying in bed or making them understand like you can't get out of bed. They don't seem to be like able to understand what's happening. So continuously trying to get out of bed, continuously walking around the house, continuously rolling around the bed. That would be signs of agitation. If you're truly allergic to morphine, we do have other things we can give you. But a lot of times people will say like they have an allergy because they felt nauseous when they took it or like felt dizzy. It's not a true allergy. And most of the time, we're not giving IV morphine. So a lot of times it's a lot more gentle. Julie, my spouse has PD in NSGFAC. Uh-oh. Last month he started to vomit on and off, taking, okay, losing weight, do it for, yeah, also during the day and agitated. Precious, unfortunately, I cannot give like true medical advice. I cannot sit here and go, you should try this or you should try that. I mean, all the only thing I'd say to that is like for sure keep advocating for him and yourself and see what more they can do, start talking about progression of disease. What does this mean? Is there more like I'm not saying this person is end of life. I truly am not because I have no idea. Just from reading that, there'd be no way to know if someone was. Um, but if they're not already on hospice or palliative care, you could always make sure that doctors know that you're open to that or at least open to hearing like what next steps are. Now, if they are in palliative and hospice care, you need to make sure the company knows what's going on and make sure they're taking action to help. Just reading through. I'm seeing everybody and everyone who says like thank you and everyone who's talking to each other. Thank you so much. I love it. Makes me so happy. My mom has end stage heart failure. What causes her abnormal breathing at night? Her oxygen drops to 60, then goes back to 90, cycles like this all night. Very, 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 very normal for heart failure, and probably very, very normal for anyone who has sleep apnea, which it sounds like she has. This could be something, nothing like not related to her heart failure. It could be from sleep apnea but it's very common for people during when they sleep for, them to stop breathing for a little bit, cut off oxygen for a little bit, and breathe a little abnormally. I'm wondering if she might have some sleep apnea. If she has like a big belly, she may have one. She may have sleep apnea. You don't have to. Really small mouth, your tongue can get, there's a bunch of things that can cause sleep apnea. Some people seem to not respond to morphine. Is that a thing? That's definitely a thing. And we need to switch things up. If someone's not responding to morphine, that's definitely a thing. I have never had someone choose a natural burial. I wish. A natural burial is basically when you get buried in the ground, and I would wanna do that if I could. Oh, precious. He was on hospice for 2 years unnecessarily and off for over 2 years. Could it be sundowning syndrome? Sundowning syndrome, yeah, it could be, possibly. It'd be too hard. It's unfortunately, I would need to know, like, his exact diagnosis, and I would I'm so sorry, precious. I have to be really careful on it. Like, I would be doing everyone here a disservice if I started being like, yes, if it's something super clear, I would be like, yes, it could be sundowning. But if it's not super clear to me, I don't want to act like I could possibly know. I'd have to be like your provider. I'd have to see him. I'd have to read through his chart. There'd be a bunch of things. My dad was diagnosed with stage 4 melanoma. Really don't want him to be in pain. I will order the rectal catheter, but any other suggestions if money isn't an issue? If he hasn't been having a lot of pain yet, he might not be having a lot of pain. So, this idea of him suddenly having a lot of pain might not be a thing unless he already has been having pain. You may also run into the rectal catheter issue if he's on hospice and they don't use a rectal catheter, if they don't use the Macy catheter. You could have an issue there, but there are many options to manage pain. I would say let's cross that bridge when we get there because he may not. The biggest thing you can do is like let his body be the guide. Don't force him to do anything. As long as he is clean, safe, and comfortable, you are good. If he is not comfortable, you work with your hospice team to be aggressive in that. But I don't necessarily look at melanoma and think, ooh, that's going to be really painful. So if he hasn't had a bunch of pain yet, then he might not. Now, if he has, you need to work with the hospice company to make sure we are super aggressive with pain management. And there's many ways we can do that. You can do that with steroids, you can do it with long acting medicine, short acting medicine, all types of things. So sundowning usually happens with people with Alzheimer's dementia, Alzheimer's, or the umbrella of is dementia, right? There's a big umbrella, dementia. And then under this umbrella, there's like Alzheimer's, Lewy body, vascular dementia, different types. And generally speaking, sundowning is when someone gets more agitated or more confused once the sun goes down. But it's typically related to that specific disease. Sometimes Parkinson's. Hi, Julie. I'm caring for my 92-year-old mom. She has dementia that seemed to be gradually getting worse. About 6 weeks ago, her dementia started progressing at a warp speed. Is that normal? It can be normal, yes. So a lot of times with diseases like chronic terminal illnesses, like Alzheimer's, dementia, Parkinson's, COPD, CHF, they'll be going along kind of steady. Not like they used to be, but like they have a new normal that's kind of steady, steady, steady. And then all of a sudden, boom, something happens. They fall, they get an infection, or just out of nowhere, they start declining. They go down here. They get down here. Everyone's like, is this it? Are they gonna die? Is this the end? They go on hospice. Okay. Sometimes it's true. Their body is like, "You know what? I'm done." And they do end up dying soon after, maybe a few months. But sometimes then they go, "Nope." Doop, boop, 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 going back up. And they don't go back to where they were, but they plateau out again for another couple years sometimes. So a lot of times, depending on the person and the disease and what's going on with their body, they'll have this like swift decline, which will get them to like a new level of decline, but then slowly kind of go back up, but not back to where they were. Does that make sense? So it's hard. It's hard. It's so hard for the patient, for families. It's so hard. If you are feeling like, how does anyone do this? I can't keep doing this. This is so hard. I must be doing something wrong. You're not. It's just that hard. It's just that hard. And it's a really gray area. End of life and disease processes and all and it's just a gray area. There is not black and white answers. And I wish there were because I love black and white. I love feeling like I have control. And this is such a big place in life where we feel like, and it's true, we don't have much control. And I feel like the only thing we can do that does give us some control is like education, preparing ourselves, learning how to be comfortable with being uncomfortable, and just remembering that you're not doing anything wrong. Okay. My wife has liver cancer and she was told she has a few weeks to live and her skin is getting gray. Hold on. I almost missed it. Looking, but she also has severe arthritis and pain. Her decision making is becoming dim. Oh, Allison, I'm so glad you're here. I'm so sorry. So glad you're here. And thank you for being there for your wife. If I can say anything to you, like I just gave the little spiel of like, let her body be the guide. Is she clean? Is she safe? Is she comfortable? If she's not, let's get some help so we can get her clean, safe, or comfortable, specifically comfortable. The gray skin, I feel like most people with liver cancer usually get yellow skin, like a yellow tint, but gray could be okay. And changes in skin color can be normal. I'm glad you're here. Thank you, Valerie. Thank you, Valerie. Hey, Steph. Good to see you. Hey, Brenda. Julie, what happens to your brain when you're not urinating and organs are shutting down? Does the fluid affect your brain? No, but the fluid doesn't affect your brain, but you do become very, very, very lethargic and very, very, very confused. So disoriented, confused, and lethargic. The main thing when you stop urinating and being able to clean out the toxins in your body, it's usually peaceful, but they usually are fully like no longer home, right? They're either sleeping 24 hours a day or super, super lethargic or confused and disoriented. Very, very normal. There's not much you can do unless they start dialysis, which a lot of times by that time they can't start dialysis. So again, you just Let their body be the guide. Don't force anything. Let them sleep 24 hours a day if that's what their body wants to do. Don't make them wake up. You just keep them clean, safe, and comfortable. If someone dies from end stage kidney disease, which means their kidneys are no longer working, they're not urinating, they've been told that this is like end stage, they will usually just fall asleep until they die. It'll take like 7 to 10 days, usually. Julie, have you seen cancer patients pass away with little to no pain? Yes. Yes, definitely. Have you had families who laugh at inappropriate times, like a nervous response? 100%. Yes, all the time. I've had many families do, having like laughing spells and stuff. I always tell them how normal it is. It's a way to like relieve stress, relieve tension. Is there an age requirement for hospice? No, anyone can be on hospice. However, I only do adult hospice, so you have to be 18 or above, but there is pediatric hospice. Is it true that kidney failure can cause sepsis? That's what we were told about my grandmother, and she died 1 week later. Yeah, so many things can cause sepsis. Sepsis is an infection in the blood. A lot of times with elderly people, they will get a UTI, which will turn severe. They can actually get like kidney issues, and then that can turn into sepsis. And then that's what you could die from. So that does make sense. What's my book? My book is called, thank you, Eric B. Nothing to Fear, Demystifying Death to Live More Fully. So, Nothing to Fear by Julie McFadden. It is a New York Times bestseller, thanks to you guys. It's out now. You can get it anywhere. Eric B, you just sent me some money. Wow, that's always so surprising. You are so sweet. Keeping mom comfortable. Dad passed July 9th. I asked our hospice team if they had heard of you. They said, "Heck yeah, she's our gal." Yay! Eric, that's amazing. Have you had more encounters with angels? Maine. Maine, I have not. I have had only one encounter with an angel. And it felt like, yeah, I that's a great question. No, I haven't. And when it happened to me the first time, it was so quick and so sudden and so unexpected, but so obviously profound. But yeah, no, only one time. If you're already on opioids for pain relief, how can they relieve pain? We can go up and up and up, Tanya. No, but true, we can. And really, if you know, we can do long acting pain medication. We can do that. We can add on immediate release pain medication from your long term. Like, let's just say you're taking um, Oxycontin ER, extended release, 20 milligrams twice a day, right? And then intermittently, you take IR, which means immediate release, 10 milligrams of morphine IR every 4 hours in between your two extended release ones. We can do fentanyl patches. We can do methadone. There are so many things we can do. So many things. Make sure you choose a hospice that has many routes and ability, a great ability to manage pain. Congrats on the 500,000. That's right. Why am I not talking about this? Thanks to all of you guys. I have 500,000 subscribers. 500,000 subscribers. Thank you so much. If you guys don't subscribe to my channel, it's free. I don't know where you do it, but you just click on it and subscribe. You can also do something where like every week, if you actually wanted to catch a live, you can do something somewhere on here. Sorry, I can't help you more. Where you can like put notifications on so it'll like ring so it can remind you that I'm going live. My mammy passed away with cancer, but she had fluid on her stomach. How could they prevent her from choking? What could they have done differently? Please, I need answers. Are you sure she was choking? That's my question to you. I'm not saying she wasn't, but a lot of times I think because there is dog hospice. Someone asked that. There is. because so many people are unaware of like what death looks like, and then their loved one looks so different that they see what's happening and they associate things they see with things they think it is, right? So she might have been breathing funny and you're like, I think she's choking. Or because she had the fluid in her abdomen, you're like, is that causing her to choke? So if she had fluid in her abdomen, that is not causing her to choke. Um, so I'm just curious. I'd have to know a lot more. I hope you'll be able to answer some of those questions for me so I can help you. How do you interview a prospective hospice? Janet, it'll be too hard for me to explain that to you in this live, but I want you to go to my channel, Hospice Nurse Julie. You can kind of click out of here and go to it whenever you're ready and look through my videos, and there will be labels on them, and one or two will be like questions to ask your hospice company. There's a bunch of questions. Also, if you don't feel like doing that and you want to get my book also has a specific chapter about like what to ask your doctors, what to ask hospice companies, things like that. Hey, Robert, thank you so much for sending me money. Hi from New Zealand. Well done on getting 500K. Thank you. I lost my auntie in 2011. She was breathing heavily, but steadily the day she went. Yet she was near inaudible at times. Is there a reason for that? Yes. So that breathing heavily is because at the end of life, we always have changes in breathing. We always have metabolic, we have like blood chemistry and exact blood chemistry that keeps our blood like exactly as it needs to be and the oxygen level as it needs to be. As we're dying, that starts changing. And the blood chemistry, as it changes, creates us to breathe different because our body is shutting down. So it's literally like there's CO2 levels rising, O2 levels are decreasing, and it's causing us to breathe funny. So that's why she was breathing heavily, but steadily. And if she was near inaudible, meaning like it was too hard for you to hear, that is because it takes a lot of energy for any one of us to speak. So I have to have a strong diaphragm, a big breath, and strong vocal cords for me to make a voice. At the end of life, even if you're not actively dying, meaning like changes in breathing and like close to the end, you may just be too weak to make a strong voice. That's why people at the end of life will often whisper or their voice will change and be a little squeakier, a little higher pitched, a little softer. And that's all because it just takes a lot to actually get that breath in your regular voice out. Let's celebrate their third super on live stream. How do I do this? Sorry, I'm like reading little messages. Anyway, thank you for the question and thank you for the gift. She was gargling up fluid. So, if someone is gargling up fluid, Um, again, I'd have to know a lot more, but that can happen a lot because specifically if you are in the hospital is trying to keep people alive, usually at all costs. So they fluid overload people. Fluid overload means they put an IV in. They're not doing it purposely. It's just like the nature of the beast. And they're giving them hydration through their veins. But eventually, someone's heart can't really handle that. So it starts backing up into their lungs, causing respiratory distress. So a lot of times that can happen in the hospital. Now, if she wasn't in the hospital and she was at home, sometimes people start having fluid come out of their mouth because our sphincters all relax. So we have like sphincters that keep in our gastric juices in our stomach. But then if we're dying and we're very close to death, very, very close, all of these things relax, right? So that sphincter can relax and you can regurgitate things that are in your stomach. You can also urinate and defecate. No, not every time, but it can happen. And sometimes they may not really be fully actually regurgitating things. It could be those terminal secretions that are building up in someone's mouth. So I would have to know a little more, but I'm just giving you some of the things that it could be. I hope that helps a little bit. I'm sure it was very, very hard. Brenda, thank you. All these gifters today. Brenda Fletcher, thank you so much. Question: do you have another angel experience? P.S. Both my parents died in hospice. Oh, Maine. I actually already answered. Maybe you didn't hear. I do not have another angel experience. I don't, unfortunately. Hey, maybe more to come. Maybe more to come, but I don't this time around. Topo Chico. Sparkling water. I think I need to go to the dentist. Ooh, I think I need to go to the dentist. Wow, that hurts. You guys. Thank you, Brenda. You're so sweet. Where are people giving gifts? Rick, if I knew, I could tell you. I have no idea how they're doing it. Can anyone answer Rick? Because I actually don't know. I don't know. You guys are more advanced than I am. You guys, I think I have a pain in my tooth. Yikes. Oh, the lower right corner dollar sign. Oh, thank you. Welcome, everybody. We have about 5 more minutes of this live. And if you don't know who I am or what's going on, my name is Julie McFadden. I'm an RN BSN. I work in hospice and palliative care. I go by Hospice Nurse Julie online, and I go live at 5 Pacific Standard Time every Thursday to answer all your death and dying questions best I can. And yeah, and to form a community of people here. A lot of the same people show up every week. If you're a caregiver at home, if you're someone who is on hospice or palliative care or is living with a life-limiting illness, like this is the group for you. So I hope you join us. Let's see, the Zen Ginger. I feel like I remember your name. I have a fear about later life due to being a redhead and being apt to need more anesthesia in some circumstances. Can you speak to if that's been an issue to you? So, Zen Ginger, that is an issue with anesthesia. That's not really an issue with pain medication usually. It's usually not. There's certain anesthetic, that's a word, anesthetic medicine that it seems to be affected by for sure. But I haven't seen that be an issue with pain medicine. I didn't do a live the last 2 weeks. I'm so sorry. I keep being like live at 5 every Thursday. I'm like, except the last 2 weeks because I was on a road trip with my boyfriend. I was gonna say with Roy, but not with Roy. With Roy's dad. Look at Roy over there. Hey, baby. My good. How long are you able to stay with hospice before any decision is made? You can only go on hospice once you decide you want to. You can't, I'm not sure exactly what you mean, to be honest, but once you're on, you can always come off hospice, that's for sure. Richie is at work. My friend died August 16th of pancreatic cancer. She now lives 6 months. Thank you, Julie. Oh, thank you, Debbie. Thank you for being there. I've been here before many times. That's what I thought, Zen Ginger. I had a near death experience with pneumonia last year. Is it normal in the ICU to have crazy hallucinations? Yes. So that's why people always the visioning is something that can happen on hospice where dying people see dead relatives, dead loved ones, dead pets. And people always say, "Oh, it's just because they're on a bunch of meds, it's delirium, it's psychosis." And I'll tell you this. I don't know what it is. I don't know why it happens, but I used to work in the ICU. And in the ICU, you can have ICU psychosis, you can have delirium, you can get really, really confused just because you're in a hospital bed, in a hospital room with tubes and beeps, and you're not sleeping right, and all these different things. So I know what that looks like. ICU psychosis, delirium, hallucinations because of medications. I see that a lot in the ICU. I don't see that a lot in hospice. Visioning, wow, everybody is really giving me a lot of money. Oh my God, you guys, I haven't had this many gifts and I couldn't tell you when. Thank you so much. Yeah, for some reason, the ICU, not for some reason, I know why. ICU psychosis used to happen a lot because there was no windows in the room. So then they started making sure there was windows in the room so someone could see outside of the room to help with ICU psychosis. But generally speaking, ICU psychosis or delirium or hallucinations that are caused from medication, it looks very, very different than what visioning is. Amy K, thank you for the gift. That's so sweet. Can you make a video about people seeing scary things? People, thank you. You know what, Amy? Okay, so I'm gonna be shooting again on like the first week of November, and then they'll start coming out. So I can make a video about that, and maybe I'll try to even do a shorter one um, on my other channels. Same name, Hospice Nurse Julie. Rick Kane gave me a $50 gift. Thank you. You guys, you really know how to make a girl feel loved. You really know how to make a girl feel loved. Is this a celebration because I hit 500,000? Thanks to you guys. You guys are amazing. Okay, it's 6:02. So I've got to go. But I will be back next week. And I don't have anything really coming up, so I should be able to make it every Thursday, 5 p.m. Pacific Standard Time. Mark your calendars. I'll be back. And don't forget to subscribe if you don't already. And if I didn't answer your question tonight, I do have literally, a boatload of videos on my channel already. They're all labeled, so hopefully you can get your answer there. If not, come back next week. Get here early, 5 p.m. Pacific Standard Time, and hopefully I'll help you. And thank you so much for all the gifts, and thank you everyone who is here and always here. I really appreciate this community. Love you guys. Roy, say bye, baby. Oh, sure. Now he's quiet. Bye. Love you guys.